Hello, class. My name is Crystal, and today I will be talking about the global problem of counterfeit drugs. What comes to mind when you think of counterfeit drugs? Illicit drugs and overdosing? Perhaps from fentanyl? What if I told you that 10% of the world's prescription drugs were counterfeit and that they are found in every country on this planet? The proliferation of counterfeit prescription medications generates a viable threat to patients, their families, global public health, and supply chains. Drug companies and governments globally have limited resources to try to combat this massive problem all on their own. Counterfeiting prescription medications is an extremely lucrative and low-risk business for crime syndicates and global terrorists. The World Health Organization, or WHO for short, recently defines counterfeit medications as, quote, substandard products that do not meet quality standards and specifications, often due to poor manufacturing practices or inadequate quality control, unquote. Counterfeit medications affect millions of people globally by exacerbating diseases and contribute to drug resistance, particularly in low to middle income countries, undermines healthcare systems, endangers patient safety, and produces economic burdens, increasing healthcare costs and loss of productivity. Additionally, e-commerce has further expanded the issue through unauthorized and unlicensed pharmaceutical sites, which advertise cheaper medications that don't require a prescription, and often advertising manufacturing in another country, shipping directly to the customer. The fight against counterfeit medications is not only a matter of policy and enforcement, it is fundamentally ethically imperative. At its core, this issue involves the violation of basic human rights. Access to safe and effective medication is a basic necessity and a moral obligation for any functioning healthcare system. By promoting transparency, integrity, and safety in pharmaceutical supply chains, we uphold the ethical principles of beneficence and justice, ensuring that all rights, regardless of geography or socioeconomic status, are protected from harm. This issue also intersects deeply with cultural diversity. Different regions face unique challenges due to varying levels of regulation, healthcare access, and cultural trust in medical systems. In many low and middle income countries, traditional or community-based healthcare practices may intersect with unregulated markets, creating a breeding ground for counterfeit drug distribution. Addressing this crisis requires culturally informed strategies that engage local communities, respect their values, and provide education in appropriate languages and contexts. Collaboration with diverse cultural groups ensure that awareness campaigns and interventions are not only effective, but also equitable. This inclusivity fosters trust, builds stronger community healthcare relationships, and ultimately enhances the success of global efforts to eradicate counterfeit medications. Scholars broadly agree that counterfeit medications pose a significant global health threat, particularly in low and middle income countries, where regulatory oversight is limited. There is consensus that stronger international collaboration, supply chain transparency, and public education are essential components of any effective response. However, disagreements arise regarding the prioritization of solutions. Some experts emphasize technological innovations like blockchain as the most effective tool, while others argue that without first addressing underlying socioeconomic and governance issues, such technologies may be ineffective or inaccessible. Additionally, there are differing views on the roles of pharmaceutical companies, with some scholars advocating for stricter corporate accountability and others cautioning against regulatory measures that could stifle innovation or increase drug costs. In conclusion, counterfeit medications represent a persistent and multifaceted threat to global public health, undermining healthcare systems, fueling drug resistance, and endangering millions of lives, especially in low and middle income countries. The growing complexity of supply chains, combined with the rise of e-commerce and the lack of stringent global regulations, has created an environment where counterfeiters can operate with alarming ease and profitability. From the economic burden on healthcare systems to the ethical dilemmas posed by criminal disregard for human life, the implications of counterfeit drugs are widespread and deeply concerning. To effectively combat this crisis, a unified global response is imperative, one that includes stronger international cooperation, robust legal frameworks, and the strategic use of modern technologies such as blockchain and digital verification tools, raising awareness through public education campaigns, training healthcare professionals, and empowering consumers with easy-to-use reporting systems can also significantly reduce the spread of falsification medications. Furthermore, culturally sensitive approaches and collaborations between governments, healthcare providers, and regulatory bodies can ensure that interventions are inclusive and sustainable, ultimately restoring trust in global healthcare systems and safeguarding public health will require a collaborative effort combining innovation, vigilance, and a shared commitment to patient safety and pharmaceutical integrity. Thank you for your time today.